Thank you very much, Mr. Speaker. Well, I'm very happy to be a part of the debate today about such an important bill, the Respect for Communities Act, or Bill C2. I suspect that we would all agree that illegal drugs have a terrible impact on our communities. There may be different opinions on how the challenges they pose should be addressed, but we all know that the worst drugs, such as heroin, have a terrible impact on our communities and destroy lives. These drugs also cause serious harm to public health and public safety. Bill C2 forms an important piece of our government's effort to protect public health from the serious negative effects of drug abuse and to maintain public safety from the impacts associated with drug use and addictions. Mr. Speaker, it's always good to have the facts when we're debating important topics like this. Please. Thank you. So I'd like to briefly mention a report from Justice Canada entitled "The Cost of Crime in Canada." The report estimated that the costs associated with illicit drug use in Canada totaled $1.3 billion in 2008 in direct health care costs for illicit drug use alone. It's estimated over $2 billion is spent annually on justice-related costs, such as law enforcement, courts, and correctional services as a result of illicit drug use. These are enormous expenditures, Mr. Speaker, and cost to society. Now, that's just for the legal costs and the costs of the health services provided. It's even worse when we consider the terrible impact on individuals, on communities, on Canadian society. The costs are enormous. And these are the direct costs to the health systems, Mr. Speaker. The impact on the individuals who suffer and the negative consequences for their family, well, they're just immeasurable. No parent should have to suffer as their child gets involved with drug abuse and end up worrying that the broken dreams, the perilous and uncertain future that addiction brings. Mr. Speaker, this government's committed to preventing drug use and breaking the cycle of drug addiction so that our communities are healthy and safe, and so that no family has to watch a loved one suffer from addiction. As part of our plan to address addiction is the National Anti-Drug Strategy. It was launched in 2007 as the federal government's comprehensive response to combat illicit drug use in Canada. Under 3 key action plans, the strategy focuses on preventing illicit drug use, treating drug dependency, and combating the production and trafficking of illicit drugs. Today, I'd like to elaborate on our government's commitment to preventing illicit drug use through the strategy's Prevention Action Plan. The Prevention Action Plan, Mr. Speaker, contributes to reducing illicit drug use and prescription drug abuse in key target groups such as youth. Funding the development and implementation of community-based interventions and initiatives to prevent illicit drug use and abuse of prescription drugs, especially amongst the youth. Discouraging illicit drug use and prescription drug abuse by providing information directly to youth, to parents, and to concerned adults. And supporting development of awareness materials and the provision of awareness sessions to school-aged youth, to parents, to professionals, and other community members. The government also supports prevention activities through the Drug Safety Community Initiatives Fund. This is a funding program that supports Canadian communities in their collective efforts to address health promotion and prevention of illicit drug use and prescription drug abuse. Projects supported through the fund focus on informing and educating Canadians on illicit drugs and prescription drug abuse and their adverse health and social effects, offering tools to foster resiliency and coping skills amongst youth to deal with peer pressure regarding illicit drug use, and promoting healthy behaviors and supportive environments that discourage drug use among young people. Projects take place in the national, the provincial, the territorial, and local community level, and they can include a wide range of activities such as school-based and peer support programs and outreach. Project activities can also include the development and distribution of resource materials as well as the sharing of best practices. Since 2007, Health Canada has provided $75 million to fund some 140 projects to discourage and prevent illicit drug use among youth. As part of our ongoing commitment to curbing drug abuse in Canada, the government is supporting projects across the country to address a wide range of illicit and prescription drug abuse issues, especially amongst vulnerable youth who have a higher risk of substance abuse and dependence. Many of the projects serve to equip young people with the knowledge and the skills required to recognize and avoid situations where there may be peer pressure to use drugs. Others are designed to provide parents and those who work with youth with drug education and prevention strategies that will help families and communities deal with the growing problem of substance abuse. In addition to providing financial support for prevention work, our government also completed a successful 5-year, $30 million mass media campaign. It was known as the Drugs Not For Me, which was aimed at youth and their parents. A key part of the Drugs Not For Me campaign was developing awareness, prevention materials for use in elementary and secondary schools. We also provided facts and background information for parents to help prepare them to engage in conversation with their children about substance abuse and about staying off drugs. The campaign made a difference. There were over 1 million visits to the Drugs Not For Me website. 1 in 4 parents reached through the campaign took action by engaging in discussions with their children about drugs. And even more importantly, there was an increase in the proportion of youth who said they knew about the potential effects of illicit drug use in relationships with family and friends, and they sought information on how to avoid drugs or to deal with drug use issues. However, despite these prevention efforts, the challenges are far from over. Illicit drug use in Canada is changing, with prescription drug abuse becoming a concern. In 2012-13, more than 80,000 Canadian kids admitted to using prescription drugs to get high. It's a very serious and alarming situation, Mr. Speaker. The misuse and abuse of prescription drugs carries the same health and public safety concerns as illicit drugs do. To combat the concern around prescription drug abuse, our government has committed an additional $44.9 million in funding over 5 years to expand the national anti-drug strategy to target prescription drug abuse. The Health Committee has recently been studying these issues and heard from a large number of expert witnesses. In fact, the committee recently completed studies both on prescription drug abuse as well as the health risks of marijuana. Now, Mr. Speaker, I know that my time is coming to a conclusion here. Perhaps it's a good place for me to stop, and I imagine I have a little bit of time left when the debate resumes after question period.
Yes, the honourable member will have 2 minutes and roughly 30 seconds plus 5 minutes of questions and comments. We'll now move to statements by members, déclaration de député, and ironically the first statement is by the member for Nanaimo, Alberni.
Thank you very much, Mr. Speaker. Back on a different subject. Mr. Speaker, many Canadians are shocked that law societies across the country voted to discriminate against Trinity Western University law graduates. Compounding the alarm is the revelation that it's big banks and big money interests led by the Bank of Montreal that influence the law societies. BMO and other large banks and corporations have been requiring legal and financial service contractors to reveal the diversity metrics of their associates, partners, and management teams. Shameful. The initiative, branded Legal Leaders for Diversity, is apparently opposed to religious diversity. Mr. Speaker, asking a prospective employee about their sexual preferences would be against the law. Denying economic opportunity to any individual or any law firm based on religious belief is just as surely a charter violation. Hear, hear. The Supreme Court of Canada and now the Nova Scotia Supreme Court have ruled against such religious discrimination. Mr. Speaker, Canadians expect our banks and our leading corporations to respect the charter rights and freedoms of all Canadians. We call on the BMO and its recruits from corporate Canada to reverse this misguided initiative.